Hi everyone, my name is Stephen Larrabee. I work in state government affairs for Harvard Pilgrim Healthcare. Thank you for coming to our post-election healthcare update. I'm joined with a man who needs no introduction, Bob Leshevsky. Many of you have known Bob for a long time. He has worked in the industry for over 40 years, 20 in operations with various insurers, and 20 as a consultant working in DC, working with insurers, providers, the whole gamut. So we're going to get started, we're looking forward to what Bob has to say because we all want to know what happened last week.
Well, thanks, Stephen. It's great to be here and great to be with all of you once again. Let me start by saying the Republicans didn't do as badly as we thought they did, whether they were going to do. The Democrats didn't do quite as well. It was sort of like the Democratic wave hit the Republican wall. It looks like the Republicans will maintain the Senate with a majority of 2 or 3 votes, which gives them a working majority. And in the House, we're going to have the Democrats with a fairly good margin. But of course, nothing can be legislated unless both houses pass it and the president signs it. So really what we've got is a Democratic majority that's going to cause a lot of trouble for the Republicans, but not really, I don't think we're going to see any more difficulty we're not going to see a great deal more accomplished. So let's look at health care as an issue. Overall, it was the single most important policy issue. The Associated Press exit polls found that 41% of voters thought health care was the most important issue. 23% favored immigration, 21% picked the economy, 11% cited gun policy. So health care was the big policy issue. It's likely the biggest issue overall was Donald Trump, but that's not exactly a policy issue. So health care became big. Why did it become big? Because of the failure to repeal and replace health care on the part of Republicans had a critical impact on many of the votes. Perhaps not as much in some of the red states, but clearly in the Democratic states, in the states where Democrats flipped some Republican House seats. An exception with the closest races, an Arizona Republican Senator Martha McSally said she was getting her, quote, ass kicked because she had voted for the health care bill. Now, when I did this slide last Friday, it looked like Martha McSally was winning. Turns out she lost. And so I guess she really did get her ass kicked by health care. So health care was a big issue in many of these states and a big difference in being able to swing the Congress. Republicans had great difficulty refuting Democratic health care claims. Democrats effectively criticized Republicans for wanting to eliminate the pre-existing condition reforms. The House bill would have given states flexibility to do a number of things which arguably could have undermined the pre-existing condition protections. The Republicans never overtly were going to change that, but they left the door open wide enough that Democrats literally drove a truck through the door on Election Day when it came to the health care issue. The lack of a cohesive replacement plan left Republicans without a counter-argument. So the Republican failure to repeal and replace really left them vulnerable. Now, having said that, it's probably a good thing the Republican bills never passed, because they would have created a great deal of difficulty in the health care markets, given all the cuts they were going to make to Medicaid as well as the insurance subsidies. If you're going to cut the insurance subsidies and you're going to take people off Medicaid and throw them in the insurance pool, you're going to increase the number of people in the pool, and you're going to give them less ability to pay for insurance. So we probably would have had a worse pool. We probably would have had a lower percentage uptake under the Republican bill than we've got even under Obamacare. Now, I think the mistake that Republicans made too often is that they didn't understand what voters did and didn't like about Obamacare. Voters may not have liked Obamacare, but that didn't mean they didn't like its health care security elements, pre-existing condition reforms, insurance subsidies, and the Medicaid expansion. And the Republican House bill would have arguably had a pretty negative effect on all of these. Now, a good example of what happened is in my backyard down in Northern Virginia, Virginia's 10th district, which is a suburban Washington, D.C. district, held for 2 terms by an incumbent Republican. She was defeated by a Democrat, 56 to 44%, so by a pretty wide margin. The Democrats stressed protecting Obamacare in her ads. Now, that's ironic because what you had in the Virginia 10th was the Democrats saying we've got to preserve and protect Obamacare, including its pre-existing conditions, but the law overall. Yet in this district, the cheapest silver plan for a family of four, mom and dad age 40, making $65,000 a year, was a premium after the subsidies of $4,500, and then a $6,500 deductible. That means the $65,000 family would have to incur $11,000 in annual premiums and deductible costs, and then they would have had a 30% copay. So not a great situation. Now, this is a very affluent suburb in Northern Virginia, and so many of the people, if not most of the people, probably don't qualify for subsidies. That same Northern Virginia family making too much for a premium subsidy, 40% of all people under Obamacare make too much for a subsidy, would have had to pay $19,000 in unsubsidized premium. With the $6,500 deductible, they'd have had a total outlay of $25,000. So in Northern Virginia, this is what Obamacare means in the insurance exchanges and the individual health insurance market for people who have to be in the individual market. And yet, the Democrat really beat up the Republican incumbent over health care in her vote to repeal and replace it, because the House bill left open the possibility that pre-existing condition reforms would go away and the Medicare expansion would be cut. Now in Virginia, we don't even have the Medicaid expansion yet. The Virginia legislature passed a bill last year to expand in the coming year, but we don't even have the expansion at this point. So why did Republicans have so much trouble with Obamacare when you have these kinds of circumstances? Again, I don't think Republicans ever understood what an Obamacare did and did not work for voters. Republicans had no viable plan to replace it, and in fact would have made things worse, arguably, by increasing the size of the pool and cutting the number of people who could afford to buy insurance. It's a good thing the plan really didn't pass. And I don't think they ever understood how to point out the continuing, particularly middle-class Obamacare failures in the face of Democratic claims. And so, when you look at this, and Arizona, by the way, is an example just like this, where people in the middle class are paying awful premiums and copays and deductibles, and yet, as Martha McSally, the defeated candidate, said, she got her ass kicked by her vote for reform, repeal of Obamacare. Really, a bizarre kind of political place for Republicans to put themselves in. So that takes us to the 2018 political agenda in Washington, D.C. Now that we have a Republican House, we have a Democratic House, and a Republican Senate being held with a small majority, what are we going to see? Well, we're going to see a lot of what we've seen the past year or so. That's lots of Trump administrative regulatory action. We'll talk a little bit about that in a few minutes, but the Trump administration will continue to change the individual health insurance market and the health care system generally as much as they can through regulatory action. And they're doing that with Obamacare, they're doing that with prescription drug moves, and they're doing that with some things they're doing in Medicare as well. The Democrat-led Congress is going to do a lot of oversight hearings. They're going to investigate Trump for about anything they can get their hands on, whether it's his business dealings or the Puerto Rican disaster with the hurricane and how that was handled. And they're certainly going to look at the changes that Trump has made to the individual health insurance market for Obamacare, things like short-term medical plans being offered. So we're going to see just a continual barrage of questioning of Trump. They're not going to be able to pass anything that'll clear the House, but they're going to do a lot to try to undermine him. A Democratic House will repeatedly try to pass pre-existing reform bills. I think early in January, you're going to see Nancy Pelosi bring up a bill that would guarantee the pre-existing condition reforms and dare Republicans to vote against it. And they may do this repeatedly over the year, trying to sucker the Republicans into votes that make them look bad. For example, there might be a bill on the House floor to prohibit short-term medical plans that allow for pre-existing conditions that Democrats will vote for, probably pass the House, and Republicans will have a great deal of difficulty voting for because the Trump administration wants to allow that option for people. So we're going to have really sort of hit-and-run attacks by the Democrats on the floor, not accomplishing anything but making a lot of noise. And also look for a debate amongst Democrats on what the big health care reform plan they're going to offer is. The way big policy issues work is usually during a presidential election season. You're going to see a number of Democrats run for president now. Each of them is going to have a comprehensive health insurance reform plan. And so each of these candidates will offer their plans. That'll be a big part of the primary elections that'll come up in early 2020. And the Democratic Party will sift and sort through all of these plans, and through the primary process, come to a conclusion on what kind of plan they're going to offer. This is what happened in 2008 when Hillary Clinton and Barack Obama ran for president. They debated their health care plans. And what came out of that 2008 debate between Clinton and Obama was Obamacare. And so through the primary process, there was support on the part of Democrats for their position. Then, when Obama was elected president, he had carried essentially what we now know as Obamacare through that election process, and there was somewhat of a mandate for him to implement it. So look for the same process going on. And I'm going to talk a little bit about what we expect Democrats to do in a few minutes, but look for the same process as Democrats come to their conclusion. And the next question is, will there be a new and viable Republican alternative for them to be able to present something as opposed to what the Democrats do? Right now, I have to tell you, I don't see anything on the table from from Republicans that I would predict is going to survive this process. But they're going to have to come up with something to counter what will be a comprehensive Democratic reform proposal. And so we'll watch that evolve over the next couple of years. So after the elections then, we're now into Obamacare, the 6th open enrollment. And the individual market continues to shrink. Mark Fair and Associates, a consulting firm, has been doing hard counts of the individual policies for some time. In March of 2016, Fair counted a total of 20 million policies, 20 million people buying individual health insurance in the entire individual market. In March of 2017, they counted 17.7 million people being covered in individual health insurance. By March of 2018, the total individual health insurance market was down to 15.7 million people. That was a reduction of 23% in 2 years. Now, many people, interestingly, during the Democratic campaign this past month, we heard Democrats time after time talk about how Obamacare was starting to work and it was stable. Well, it's been melting, in fact. It's not been stable. It's stable in terms of the number of insurance companies in the market. It's been stable the last year because the insurance companies haven't asked for huge rate increases, having asked for huge rate increases the prior years. But the prices have gotten so high now that the market has just continued to melt. The unsubsidized market is the part of the market that's getting hit the hardest. Really, if you've got the poorest people getting the biggest subsidies for the deductibles and premiums, they don't care what the premiums are. They don't care what the deductibles are because they're immune from it with their subsidies. But people who get fewer subsidies or people who get no subsidies, the middle class, have been hurt really hard. And you can see that if you look at the unsubsidized individual health insurance market. Now, Democrats ran these past few months saying that Obamacare was working pretty well. Republicans never countered that argument. And it's interesting to look at the statistics. In March of 2016, there were 7.5 million people covered in the off-exchange market getting no subsidy in individual policies. In March of 2017, that was down to 5.6 million. In March of 2018, it dropped another 25% to 4 million. So we've seen one precipitous drop after another. If we look at the overall market, not just the subsidized market, 4.5 million people have fallen off the individual health insurance rolls in the last 2 years. And about 3.5 million of those were unsubsidized. And yet Democrats ran on a platform of protecting Obamacare, and Republicans were unable to counter those arguments. Mark Fair also reports that 132 issuers were currently selling exchange plans. This is 2018, down from 252 in 2015. In 2018, 8 states got coverage from only 1 or 2 carriers, and over half the U.S. counties had just one insurer, many of them small population counties. So, again, Democrats said we have a stable market, but these are the facts. And what's even more surprising is how incapable Republicans appeared to be able to rebut those arguments. Now, while the market's been melting, the carriers have increased the rates, and actually the carriers are starting to make some money. They're starting to make some good profits. They finally got the rates up there. Many people said we get into a death spiral. Well, you can't have a death spiral when such a large percentage of the market is so heavily subsidized and immune from prices and deductibles. So the Obamacare market has really retreated into a cove of people who are pretty much protected from the prices, while the people who aren't protected from the prices have really melted from the program. And as you can see here, in the second quarter of 2018, the medical expense ratio was down to about 71%. And you can also see that premiums earned have dropped, and they've dropped because people have been falling off the rolls. Now, the Trump administration has been doing its best to try to remake the individual health insurance market, clearly trying to create an alternative individual market for its middle-class constituency hurt by prohibitively expensive exchange policies. So, you had all these people with the red hats showing up at the Trump rallies saying, I can't afford health insurance anymore, fix it. And without being able to repeal and replace and craft a Republican alternative, the alternative has been to do some regulatory things to try to provide relief for people who don't get subsidies. And the relief has come in the form of trying to go back to 2013, trying to go back to the pre-Obamacare era when we had pre-existing conditions and a lot of flexibility in the kinds of individual policies we could sell. Obviously, in this market, if you can come up with a policy that isn't benefit mandated and, most importantly, can not cover pre-existing conditions, is subject to medical underwriting, you could come up with a pretty cheap policy. And Trump, through regulation, has found a way to do that. And that is, through regulation, to do two things. One, allow association health plans down to one-life groups that would get rid of the benefit mandates in the small employer market and the self-employed market. And the second, and the much bigger one, is allow so-called short-term plans. Short-term plans are accepted coverage. They don't have benefit mandates, and they can underwrite. So pre-existing conditions don't have to be covered. Take these accepted benefit plans that the Obama administration had limited severely and allow them to be sold for the longer term. In other words, long-term, short-term plans. And so the Trump administration has issued regulations saying you can now have short-term plans up to 36 months, 364 days, but renewable 3 times, so that people can purchase these cheaper policies. And what this is going to do is bifurcate the market and allow many of these people who don't get subsidies or get low subsidies, who can qualify through medical underwriting, to go back and get the kinds of cheaper policies we've had in the past. Now, short-term policies have largely been limited benefit policies. Democrats have called them junk insurance because of their limitations. I think you're in fact going to see some fairly comprehensive major medical plans. There's nothing in the regs that says you can't do a old-style Blue Cross comprehensive major medical 80-20 plan under these regulations, and I think you're going to see them. Now, this varies a lot by state, as some states don't allow them. And you're in a part of the world where it's generally not allowed or severely restricted. But in the rest of the country, I think we're going to see this really take off. And that's going to put some pressure on your politicians, state politicians locally, when they see the number of people now coming into these policies, being able to buy cheap policies, being able to buy policies with good health that are a lot cheaper. I think there's going to be some real question here as to why not to do it here. Now, in the long term, this is no solution. This is just rearranging the deck chairs. Because what you're doing when you create the short-term plans is you're creating a marketplace that's bifurcated with the low income and the sick in one pool, Obamacare, and the upper income, middle class people who are healthy in another pool. And of course, it just undermines the pricing in the old Obamacare pool. So we're going to end up in many states probably with the Obamacare insurance exchange products being not much more than a high-risk pool and being very expensive for anybody who doesn't have the subsidies to pay for it. People with pre-existing conditions who can't buy the short-term plans that need health insurance, their income's too high for subsidies, are the ones that really get caught in this tangle. But that's where Trump is headed. The Democrats don't have the votes to counter him in the Congress. They hold the House. They may pass all kinds of bills to outlaw this, but they'll never make it through the Senate. So this is kind of going to be the status quo for Obamacare for at least the next couple of years. What you see in Obamacare is what you will get for at least the next couple of years, because no one in the Congress is going to have the power to really change much. Also, Trump is beginning in 2020 giving states the waiver ability to allow consumers to buy the short-term plans in the exchange and even get subsidies in the exchange for them. So this is really going to help them take off. The latest proposed rule from the Trump administration would let employers pay individual market premiums, including on the exchanges, by using HRAs, an expansion of the limitations that Obama had put in. Clearly, a bifurcated market is on the way, and also a market where some states are going to have very different markets than others. And here in New England, you're going to have a very limited and structured market when it comes to these new flexibilities compared to what we're going to see in most of the other states. And the comparison will be obvious. And that will likely put pressure back on state legislatures here for what they're going to do about that. Now, Medicaid is a program that continues to expand, be profitable, and a big part of the market. Obviously, you're not in the business of selling Medicaid, but what happens to Medicaid is very important to what happens in the employer market and the individual market. What the Republicans wanted to do with Medicaid is to cut spending significantly. You can see the current law there under Obamacare and what the Republicans were proposing in their repeal bill last year in that lighter line on the bottom. Very substantial cuts, and that did not happen. If they had done that, they would have also cut substantially the number of people enrolled in Medicare and Medicaid. And what that would have done is driven more people into the individual market. At the same time, they were going to cut subsidies in the individual market, which would have made the medical loss ratio far worse. So it's really lucky for Republicans, I think, that they didn't pass their bill, because they would have really made things worse. And it was interesting to see what voters did with Medicaid. Here in New England, you've generally had an expansion. It's been somewhat controversial. Maine still hasn't expanded, but you've now elected a governor who said that she will expand it. We've had 3 deep red states in the election last week that voted to expand Medicaid under Obamacare, which is going to add a lot more people. Idaho, by 61 to 39, passed a Medicaid expansion bill. Nebraska approved a Medicaid expansion bill with 53% of the vote. Utah with 54% of the vote. And of course, Maine, it was essentially on the ballot in the governor's race, and apparently we're moving forward on that now. Montana rejected a ballot measure for how it will be paid for, but that doesn't necessarily mean Montana's going to go backward on the Medicaid expansion. It's still debating how it's going to pay for it. So what we had last week was a substantial support for expanding. And in some other states, for example, like Wisconsin, where the governor refused to, where Governor Walker refused to expand, well, he was defeated by a Democrat who said he was going to expand. So we're going to see substantial more expansion on the Medicaid side. And the business of managed Medicaid continues to thrive. We're up to $92 billion $93 billion of premium now in the Medicaid business, with a medical expense ratio of 88.6 going down and being very profitable. You know, it used to be that Medicaid was just a government-run program. It is now a government-sponsored program, generally run by insurance companies, and very profitably, and it's a very big business. The Medicaid expansion under Obamacare has added 12 million to the rolls. Now we've got a number of other states that recently expanded or are going to expand. We've got a number of states with applications pending for work requirements that people have to be working to some level or trying to find work before they can be on the program. And that has been really a rationalization for many Republican governors and legislatures to go ahead and expand now. 2/3 of Medicaid beneficiaries are now enrolled in Medicaid private contracts, up from 54 million, up from 20 million in 2000. $300 billion in Medicaid money is paid to insurers, up from $60 billion 10 years ago. Medicaid specialist Centene stock has soared 400% since the ASA's Medicaid expansion. So it's been one heck of a good business for the industry. Now let's talk about Medicare for All. Because now that the Democrats have captured the House and feel some sense that they can be successful in 2020, the question is, what do we do with Obamacare? Democrats have defended Obamacare the last 2 years and touted it during the past election. The fact of the matter is, most Democrats understand that Obamacare is not working very well and needs to either be fundamentally fixed or replaced with something even more aggressive. As soon as you start to see the Democratic presidential candidates' plans, you're not going to see anybody defending Obamacare. They're going to want to go to the next step. So that takes us to the Medicare for All debate, which is now back on the table because of the failure of Obamacare and the Republicans' failure to repeal and replace it. We're looking now again at Medicare for All, a Canadian-style system for the United States. And so the Medicare debate's going to be hot and fast. Medicare's administrative costs were $8.1 billion in 2017, 1.1% of total spending. Advocates will argue that Medicare is a more efficient way of doing things in the private market. That expense ratio includes all of the ancillary costs of running Medicare. Putting the federal cost together with the cost of private plans administering Medicare Advantage, and the total is up to about 7% of total spending. Medicare's private drug plans, Part D, also incur in medical expenses of about 11%. AHIP, the Health Insurance Industry Trade Association, pegs private plan spending at about 13%, including profit. So as you can see, advocates for Medicare for All are going to push hard on the notion that going to a Medicare for All single-payer system is an excellent way of cutting administrative expenses and cutting the cost of the program overall. As we look at Medicare more in depth, we find Medicare's average spending per beneficiary is just over $12,000, while the average person in a private plan incurs about $6,000 cost. And that makes the expense ratio look better because you've got so much in premium per person in Medicare. However, the average per person administrative cost of Medicare is $132, while it's $700 for private plans. So really, advocates for Medicare for All have a point when they say a Medicare for All single-payer system is going to be a lot less costly from an expense standpoint. Of course, the counter to that is Medicare does almost nothing to manage costs. And Medicare for All gives you no choices. You're just stuck in a one-size-all-fits plan. Maybe the biggest counter-argument to Medicare for All is the way providers are paid. Bernie Sanders says that if we do Medicare for All, we'll be able to finance a plan that's going to have far lower premiums, no deductibles, no co-pays, everybody's covered in a cheaper plan. And you know what? I think Bernie Sanders is actually correct in that argument. But here's the hitch and the giddy-up. That's true because Medicare pays hospitals, for example, half what private sector health insurance pays. So if you just cut all the providers by 50%, you can give a lot of cheap health insurance away. But if you cut the hospitals by 50%, what's that going to do to your health care system? And so here are the facts. If you look at the commercial price being paid to hospitals on average for all med and surgical stays, the average commercial price being paid to the hospital is $21,433. The Medicare fee-for-service price on average for the same basket of services is $11,354. So that's why Medicare for All can work better, and not the expense ratio is small potatoes. A single-payer system works better because it pays, or could work better, because it pays the providers half as much. But if you paid the providers, if you paid the hospitals half as much, you'd bankrupt the hospital system. You simply couldn't do it. So the problem with the proposals for Medicare for All is they're going to have to deal with this issue of how you're going to pay providers. Because if you don't pay providers the same amount, the savings are going to be insignificant, and you're not going to have the savings in the program. Now, I think as we go forward, you're going to see Democrats put together some pretty comprehensive reform plans. My guess is that many of the Democratic candidates are going to put plans together that look a lot like the plan that was just released by the Center for American Progress, which is a health policy shop in Washington, D.C., dominated by Democratic healthcare policy wonks, out of work, given that there's no Democratic administration. So a lot of former Clinton people and Obama people are in the Center for American Progress. And here's what they've come up with. And I think it really will be the kind of template you're going to see as Democrats proceed during the election. They came up with a plan called Medicare Extra for All. It's a hybrid single-payer plan. It creates a Medicare-like program that would replace Obamacare, Medicaid, CHIP, Veterans Care, TRICARE, FEHBP, and even Medicare. It would allow employers to continue offering insurance, large employers to continue offering insurance, but give them the opportunity to buy into this program for their employees, paying 70% of the cost. So the idea is employers can continue. This is arguably much cheaper, and employers will have the option to buy in, and the architects hope that most employers will ultimately buy in. Small employers would no longer be required to contribute toward their employee costs. In other words, the small employee under 50, people would be eligible for this. If a small employer wanted to provide something, they could, but their workers are going to get free health care in this system, so why would they? States would essentially make their current Medicaid contributions to the new program. Non-expansion states would eventually pay the full freight. The new program would use the Medicare fee schedule to keep costs down, the argument I just showed you and the problems and the issues with this. And as a result of providing the Medicare fee schedule at half the reimbursement for hospitals, about 80% of the reimbursement for doctors, it would be able to provide zero or low deductibles, free preventive care, free chronic disease treatment, and free generic drugs. That's the argument that the architects make. And that's somewhat legitimate if you cut the providers in half. With the exception of employer-sponsored insurance, private insurance companies would be prohibited from duplication of Medicare extra benefits, but they could offer complementary, presumably excess supplemental benefits during an open enrollment. Complementary insurance would be subject to a limitation on profits, banned from denying applicants, charging premiums based on age or health status, excluding pre-existing conditions, or paying fees to brokers. So they foresee a program very limited for the insurance companies with no broker involvement. They would allow the health insurance industry to continue via Medicare Advantage-like relationship to be called Medicare Choice. So you've got the single-payer Canadian-style system like Medicare, except like Medicare today, insurance companies could offer a Medicare Advantage-like product. They're calling it Medicare Choice in this regard. So that's why it's a hybrid system. It's single-payer with Medicare Advantage plans, if you will, available to everybody, available to 20-year-olds, 30-year-olds, 40-year-olds, and so forth. So people would have the option to opt into a United Healthcare or Aetna or Harvard Pilgrim or Blue Cross style plan, presuming those carriers offered it in the market. Medicare Choice would be available to virtually everyone. However, private insurers participating would be limited to 95% of the Medicare extra premium, and the program would be subject to competitive bidding. Current Medicare beneficiaries would stay in traditional Medicare until they aged out. Medicare supplement would eventually disappear, so people could keep it. It would be grandfathered, but if you're in the Medicare supplement business, there would be no more sales. Medicaid managed care would be gone. Medicaid would be merged into this. So we've got one system, Medicare, this Medicare program for all, with the Medicare Advantage style opt-out available. Aside from employers, customers who continue to operate the programs, insurers still participating would serve these markets by providing the Medicare Choice alternative to former customers. Now, they haven't put any cost estimates into this thing yet because there's obviously a huge problem because it's all predicated on paying current Medicare reimbursement. And that's the big stumbling block that Democrats are going to have to figure out how to get around. You know, they're promising the world here, and theoretically, if you're going to cut Mass General's reimbursements by 50%, you can make this work, but that's not terribly likely. So, that's the kind of debate we're going to see heating up over the next 2 years as the various Democratic presidential candidates get their campaigns and their policy proposals going. Just remember Hillary Clinton and Barack Obama in 2008. They created health care reform plans that ultimately became literally the kinds of plans that Clinton and Obama were advocating in November of 2008, looked to the 90th percentile like the Obamacare we've got today. And that's the process the Democrats are going to go through over the next 2 years. Whether they win the election or not is another big question. My sense is Trump can very well be reelected. It depends on who the Democrats run against him. If the election were held today, I think Trump could defeat many of the left-wing candidates that are thinking of running. My sense is the Democrat with the best chance of beating Trump is probably Joe Biden. He's the only one that I see right now that can beat Trump, assuming we don't have any developments over the next couple of years that make it more difficult for the Republicans and for Trump. So if the election were held today, there's no certainty that the Democrats are going to win this election. One of the issues that Democrats and Republicans will be talking about, that Trump's been talking about a lot, is prescription drugs. And this is an issue that Democrats tend, at least at the highest levels, agree with Trump on. Everybody agrees prescription drug costs are too high. Everybody agrees the prescription drug industry is getting away with murder. Everybody agrees we need to do something about it. Of course, when you get into the details, it's another matter altogether. But here's an issue where Democrats and Republicans could conceivably come to some agreement in the coming 2 years. It'll be difficult, but maybe this is the one they could do something. Trump promised to take major action on escalating costs. Pfizer and other companies, he went directly on it, and he was able to get Pfizer to agree to a moratorium on drug prices, and a moratorium that Pfizer is now backing out of. So the drug companies are so powerful and so willing to take on the federal government that even after Trump putting the screws to them, they're raising their prices again. Despite Trump's calls for fewer drug prices, there have been 96 price hikes for every cut in the first 7 months of 2018, based on an AP survey. The Associated Press surveyed 26,000 U.S. list prices for brand name drugs. There were fewer price hikes in 2018, but still there were 4,412 price hikes and only 46 cuts after all of Trump's rhetoric. In June and July, right after Trump's price cut promise, there were 395 increases, 24 decreases. The drug industry ain't afraid of anybody in Washington, D.C., including Donald Trump. The median price increase was down a little bit, but all the indications are now that the drug companies are going to resume their increases for 2019. The Associated Press asked 24 of the largest drug companies this summer if they plan to cut drug prices. None said they did. And the Trump administration is trying to do a number of things through regulation. That's really the only leverage they have because they can't get anything through Congress. And the Trump administration came up with a regulatory proposal in the last couple of weeks that is intriguing. It would take advantage of lower cost price drugs in Europe and other industrialized countries. So the Trump administration would create a market basket of 16 industrialized nations to determine a reference price for certain Medicare drugs reimbursed in Part B, usually infusion drugs. Part B, of course, is drugs that are paid in the doctor's office, such as chemotherapy drugs. Medicare Part B accounts for just 11% of all Medicare drug spending, essentially using what a group of single-payer nations pay for the same drugs as the U.S. Medicare price is the objective here. They would run a Medicare demonstration project between 2020 and 2025. They estimate substantial savings. But what's interesting here is that a Republican administration would reach out to European nations with single-payer systems, use the single-payer prices they've negotiated as the reference price upon which to base American reimbursement. And that's a pretty substantial step. It's only in Part B, but the precedent here is quite significant. Secretary of Health and Human Services Azar argued that we're paying upwards of 300 or 400%, in some cases 700% more than other countries do, and this is the way to bring that down. But again, a Republican administration predicating their change on doing what these single-payer nations are doing. Huge pushback from the pharmaceutical industry. They're going to fight this tooth and nail. It's going to be interesting. Watch this very carefully, because it's going to be the pharmaceutical industry versus the Trump administration, and likely some Democratic allies as well. So this is going to be the big battle, the big healthcare battle of the giants in Washington, D.C. over the next couple of years. If the pharmaceutical industry lets the Trump administration get away with this, then the door is wide open to government intervention in the United States in pharmaceutical pricing. And the Trump administration is also doing some things on drugs that could have an impact on Medicare, trying to bring the free market back to Medicare pricing. Right now, for example, physicians and hospitals just take the average Medicare sales price, add 6% to it, and average drug price, add 6% to it, and they get reimbursed for that. And the Trump administration is saying, no, wait a minute, we've got to do some competitive bidding on that. We've got to use third-party vendors to do that. HHS would also remove incentives for doctors to prescribe more expensive drugs by paying them a flat fee for storing medications instead of a fee based upon a percentage of the drug prices. So the Trump administration is doing some interesting things, and they're taking the drug industry on head on, and it's going to be interesting to watch how this develops. Quickly, in the employer market, I just wanted to make one comment here. I have one slide I wanted to show you, which I thought was interesting. Based upon a white paper put out by Willis Towers Watson for the Affordable Health Insurance Coalition recently, they made a couple of really interesting points. With the unemployment rate the lowest since 2000, 3.9% in their study, it's actually down to 3.7% in the most recent report. Corrected for inflation, wages are up only 2% since January 2015, about 0.5% annually. So with full employment, wages just aren't up. What's going on? For the bottom 60% of workers by income, wage gains have been completely wiped out by contributions for employer-provided health insurance. For the bottom 50% of workers, employers' health insurance contributions average 30 to 35% of the total compensation package. From 1999 to 2015, worker premiums for a family plan more than doubled in inflation-adjusted dollars from $2,000 to $5,000. So for both the worker and the employer, the health care costs have sucked up the wage gains. Here we are in a period of full employment, and yet wages aren't up. Is it because employers aren't giving them more money? No, it's because the money's being sucked into the employer health benefits being provided. And this is a big issue moving down the line, down through time here, as Democrats suggest that the way to bring health care costs down is a single-payer system. That kind of argument has the potential to resonate with workers whose wage gains have been sopped up by the private sector health system. So this is an issue we have to watch very carefully. And it's a dynamic that's a bit under the covers that we're not seeing, but in fact could come back to haunt the private system. So between 2019 and so for the next 2 years, 2019 to 2020, what should we expect? Hyperpartisanship like we've never seen before. Investigations in Congress, taking on Trump, looking into Trump's finances, looking at hush money being paid to his girlfriends. How much did, quote unquote, the Trump administration cover up in the Puerto Rico hurricane? And anything, the Trump tax returns. How much money is Trump really making? It's just going to be nonstop, and it's going to include health care because they're going to come back and do investigations about short-term plans and whether they're legal and if they're screwing up the market and so forth. It's going to be constant. Democrats are not going to be able to pass anything that goes through the Senate, but they are going to be able to make tons of noise. I see no significant legislative accomplishments. Watch the prescription drug dynamic, the potential for a deal there between Republicans and Democrats. I think remote, but it's going to be interesting to watch the clash of titans, the pharmaceutical industry, the federal government, and the dynamic that Democrats play in that whole process. I see no legislation of significance other than perhaps something on drugs regarding health care or fixing Obamacare or repairing Obamacare or anything of that sort, because there's simply no agreement on how to do anything. More regulatory activity from the Trump administration. I just showed you a few pieces of that. Prescription drugs, short-term plans, allowing subsidies in the exchanges to be paid for short-term plans. They're going to do a ton they're really going to push the envelope here. Ironically, Republicans hated the Obama administration using regulation to legislate. The Republicans are going to set the world's record. They've already started, and I think they're going to continue to do that. And of course, the Trump administration versus the drug industry and the Democratic part to play in that will be the fascinating thing to watch. Democrats will now begin the 2020 presidential nominating process, and with it, the development of their health care plan. And they're not going to fix Obamacare. There's most of them, the people who really understand health care on the Democratic side, know that Obamacare cannot be fixed. The Medicaid expansion is, of course, done fine in the confines of how Medicaid works. That's an unsustainable entitlement, but it's functioned. The exchanges are just a disaster, and they're not going to try to fix that. They may put some health care bills up to increase subsidies for the middle class and do some other things, but that's going to be more for show so that the Republicans can vote against providing additional subsidies for their middle class constituents. That's just a political trap. That's not going to be serious that's not going to be serious policy legislating. And I think one of the other big questions to watch over the next couple of years, will Republicans be able to get their act together and come up with an alternative? Donald Trump's was the presumed Republican nominee. He and his administration have shown no interest or really ability to put together any kind of Republican health care plan. Where will it come from? Who's going to do it? And how are they going to be able to unite the Republicans around any kind of Republican alternative? That's a big question, and I have my doubts that there's going to be much other than Republicans saying, attacking Democrats. I don't think there's going to be much other than Republicans attacking Democrats over single-payer health care and why it's a bad idea and so on and so forth, but I'm not confident there's going to be an alternative there. So that's what we're going to see over the next 2 years. With Obamacare, what you see is what you get until we have one administration or another that has the votes to change things. Stephen?
Well, Bob, that was excellent. I know for those of us who work in politics and policy up here in New England, we can often get isolated in the things that are happening in our states. And oftentimes the regulatory environment isolates us from what's happening around the nation. But I think it's important, as you mentioned, for employers, brokers, everybody to have a national perspective because we all play in this ecosystem. And oftentimes what happens in another state does impact, eventually finds its way to New England.
Yep.
So I appreciate that. Thank you so much. And I think we have some time for questions. I've got a few of my own, if you don't mind.
Go ahead.
And so let's filter through some of these. I think one important thing you touched on, certainly as it applies to maybe a potential Democratic plan, but what do you see the role of brokers being in the future, both with regards to state policy and federal policy?
Two things. First of all, and you saw it in the Center for American Progress proposal, we saw it in Obamacare in 2008, 2009, where Democrats assumed brokers would go away, that the exchanges would take over, and the Obama administration early on was very broker unfriendly, later came around to understanding the role of brokers, but was very broker unfriendly. Center for American Progress plan, again, just overtly gets rid of brokers. I don't know what Democrats' problem is with brokers, but it's clear that they don't like brokers, okay? Having said that, it's also clear that the market needs an expert intermediary. And every time they've tried to get rid of them, they've come back to understanding that, sometimes belatedly. I don't see the Democrats being able to totally remake the system. I mean, this is a proposal. It goes through a legislative process. If they were to pass a next generation Democratic proposal, it would be so changed and refined by the legislative and compromise process that it would bear resemblance only to the broad structure. So I will say two things about the broker. Number one, beware of Democrats. I mean, they just never have understood the value of the broker, and that appears to continue. Number two, I'm not staying awake at night worrying terribly about the brokers because I think the role that the broker fills with the consumer and with the employer is obvious. Right. As long as there's choice, if there's no choice, there's no need for a broker. But as long as you have a market with choices, the broker is fine. So I think there's reason for brokers to be concerned, just as they were in 2008. But I think that the vast majority of brokers are going to see their way to retirement without too much difficulty.
Yeah, and I completely agree with you. We certainly saw that even going back to 2006 with Romneycare.
Yeah.
At the time. It does take a little while for folks to come around in these health reforms, but we did, and we certainly see the value of brokers playing today in there.
As long as there's choice, when the day is done, the consumer voter's in charge.
Right.
And the consumer voter wants help.
Exactly. Yep. Yeah, and the brokers certainly fill that shoe for
absolutely
a whole bunch of folks purchasing insurance. Along those lines, speaking of employer-sponsored coverage, because that's really what we're talking about here, is there any threat to the preferred tax status the employers enjoy with regards to offering health insurance?
The tax deductibility of health insurance. Probably not. Again, there are many policy wonks that would like to get rid of the tax deductibility of health insurance. It's one of the biggest tax preferences of all time. The problem is that it is so crucial to being able to pay for health insurance. You know, the last Kaiser survey now says the cost of employer-provided health insurance is in the $20,000 range. Okay, with the employer paying about 3/4 of that, the consumer paying 1/4 of that. I mean, goodness, that's a $15,000 tax benefit to the worker, and it is so large that it's the only if the Democrats can pass a single-payer system so it doesn't matter.
Right.
That's the only issue here. But no, it's not. It's the biggest tax benefit people get.
Yeah, and just quickly on the single payer issue, I've read a lot of the same studies that you referenced in here and looked at a number of the different proposals. We were at a health policy commission, which is a think tank here in Massachusetts. It's kind of state-run and organized, and an expert came in from Harvard to talk about health policy around the globe. And you know, we went down a path of discussing the Denmark health system, and eventually he concluded, well, if you can give me the Denmark political system and the Denmark electorate, then we can have a conversation about the Denmark healthcare system.
That is absolutely correct.
Yeah.
Yep.
And along those lines, since we're talking about taxation issues, is there any hope for compromise with this new Congress around tax issues that are important to employers, specifically in healthcare? The health insurance tax was delayed, but will come back. And the Cadillac tax, which we've tend to forgotten about because it keeps getting kicked down the road. Right. All of a sudden, we're looking at 2022, and that's not that far past the next presidential election.
And not that far forward in terms of employer planning.
Right.
You know, the audience will remember the Medicare physician fee cut fiasco we had for 15 years, where every year Medicare physicians were going to get cut 20%. And at the last minute, the Congress avoided the cut. And they kicked that can down the road every year and every year and every year. And then a few years ago, they finally figured out a way to be able to get rid of the thing, okay? I think that's what we're going to have with the HIT tax and the Cadillac tax. I don't think anybody's ever going to pay it, either of them. But we're going to come down to these budget fights and these budget compromises at the last hour that will put it off. So in the marketplace, I think employers have to assume there's the possibility. And they have to assume that it could hit them and they need to plan for it, even though the likelihood is not going to happen because the Congress doesn't do these things the smart way. It does it at the last minute through a series of compromises.
Right.
So I don't think people are going to pay these taxes. But I do think it's going to so come down to the wire, there's still going to be a factor until finally, maybe we have a comprehensive health insurance reform bill that occurs in 2023. Finally, somebody, either side, figures out how to do this. Right. And then we clean this mess up.
Right.
But I think we've got this mess until we get a comprehensive fix that this is folded into.
Got it. Thank you. With regards to pre-existing coverage protections, certainly in New England, almost all of our New England states have state laws that prohibit pre-existing condition underwriting. At a federal level, has that issue become so toxic for Republicans to go through There's no chance of a rollback of that except for maybe through an alternative risk pool, like you mentioned, the bifurcating of the market. But more practically, what do you think the Democrat plan and agenda is on enhancing pre-existing conditions protections?
Well, Pelosi's going to bring some votes up. First of all, Obamacare, Obamacare technically says you can't have a bill, you can't have short-term plans. I mean, the Trump administration is way out on a limb here, and I think the courts are going to wade in on this at some point on what an accepted plan is. But Pelosi is smart, and she knows pre-existing conditions were the big issue. Right. And they probably won her between Trump's rhetoric, just Trump being Trump and upsetting so many suburban voters, and the pre-existing condition issue. That's how she got the Congress back. Okay. So she's going to ram this down the Republicans' throat every chance she gets. So she will very quickly in January have a bill out there that would get rid of the short-term, make it clear there are no exceptions, and the short-term plans are dead, and you don't screw around with that. The Democrats will pass that bill overwhelmingly. Republicans are really going to be in a tough spot. Do they vote for that and therefore eliminate the short-term plans that, Trump would veto that bill?
Sure.
Okay.
Right.
So Republicans are really pretty much going to be forced to support the Republican agenda. Some will peel off. It'll never be that bill will never be taken up in the Senate. It will die in the Senate. You recall in the lead up to the 2016 election victory by the Republicans passed an Obamacare repeal bill. I forget how many times now. It was like 10 or 20 or some large number of times. The Republicans passed Obamacare repeal. And of course, they could keep voting to repeal it because it wasn't going to go anywhere because they didn't have the votes. They didn't have 60 votes in the Senate to do it.
Right.
All right. So it was a cheap vote.
Right.
Pelosi's going to do the same thing. They're just going to keep sending
anything you can do, I can do better?
Yeah, they're going to keep sending the Republicans these bills that are going to embarrass the Republicans and to reinforce the issue. But of course, it's not going to go anywhere.
Well, that is raising short-term plans and raising association. I can see that we've had a few questions filed about the status of association health plans here in New England. One question in particular was whether or not a state like Massachusetts would allow that. From my perspective, where I sit and working in state government affairs, Massachusetts, there's some open question about whether the law outright prohibits association health plans here in the state. And so that would have to go through a legislative process to allow that. And I think there's, very, very small chance that full Democratic majorities in both branches in Massachusetts would go down a path to allowing associations and essentially
There's no Republican political wave that's going to force this in the states that either didn't like it before or were undecided. The wave is actually the opposite, to protect pre-existing condition reforms. Right. So, no, you're going to see brokers are going to look at other states somewhat enviously that they can allow pre-2014 health insurance plans for people who are, we got 5 million people that fell off the rolls in health insurance in the United States because they can't afford Obamacare. Right. This is going to be a godsend for most of those people. Is it good policy? No. It's rearranging the deck chairs. It's lousy policy. You got to fix this thing, not bifurcate the system. But if I were a consumer and I couldn't afford $26,000 for health insurance, and my family were healthy, I would be thankful to have access to that short-term plan.
Right. And I think that kind of goes to our next question, which is, do you ever see auto insurance, health insurance looking more like auto insurance, where you can shop around by state to purchase a plan that works for you? I mean, from my perspective, again, I think this goes back to associations. There's just some natural fear on the part of regulators, the insurance departments, that no matter which state you're in, whether it's a Democratic or a Republican administration, who's ultimately the consumer affairs department for that policyholder, right? They don't want to have...
selling insurance across state lines has been around for a long time. It's been around since the 90s. And Donald Trump at the presidential debates in 2016 got up and said, we got to get rid of the lines. Nobody knew what he was talking about. Well, he half understood the briefing he got on selling insurance across state lines. Right. Okay. And I think that may have reached its height under Trump at the debates. the pendulum, I think, has never favored this. A lot of states rights Republicans, you know, you got liberals don't want that to happen, but you have a lot of states rights Republicans that don't want people screwing around in other people's states. And you take the combination of those two things. This has never gone anywhere. Trump is now doing some things by regulation. We'll see how far he gets. But no, I think that Massachusetts is Massachusetts and New Hampshire is New Hampshire, and it's your health insurance system.
Right. Well, thanks, Bob. That's all the time we have today. I want to thank you again for coming and providing us this national perspective. I know the brokers and employers that have had a chance to see you before really appreciate your perspective. It's certainly unique and interesting what's happening around the country, and it's something we have to keep our eye on to understand what could happen here in New England.
Good.
Lastly, I want to thank all the brokers and employers who joined our webcast today. Just so everyone is aware that if someone in your company was not able to view this webcast or you would like to view it again, we will be saving it at the same link that you entered in today, and you can view it for up to the next month. But we really appreciate everyone participating. And obviously, if we can do anything more here at Harvard Pilgrim to answer any of your questions, you can get in touch with your sales executive. And we look forward to talking to you next time, Bob. It won't be that far along, and we'll be doing another post-election wrap.
That's right.
Thanks, everyone.